A couple slides, and I will point out what's important. As far as myself, I practice out in North Scottsdale, so I'm mostly at Thompson Peak Hospital. Maybe about a quarter of our patients are from the Rio Verde, Fountain Hills area. We're one of the groups that goes out to Fountain Hills, and there's not that many, so I think that's probably why. So I grew up here. Well, not here. I grew up in Chandler. I left after high school, trained at Duke and Hospital for Special Surgery, and I'm back after a while. So,
good school.
Yeah. So I'll talk just really briefly about how your spine is normally put together, and when it's appropriate, I'll refer you to the very small screen that nobody can see. So basically, your spine is, most of the problems that we see in your spine occur in your neck, and they occur in your lower back. And most of the mass of your spine is from here to here in your chest. So that whole area is attached to your rib cage. We don't see a lot of problems from that. People always complain of neck pain. They complain of back pain, but they don't really complain of pain in this region. So we'll focus on most of those. Today we're talking mostly about low back pain. Low back pain is much more common in golfers, of course, because you use those muscles to a much greater extent. So just to talk about, and I might pass this around, this is as good of a model as any. So this is a model of your lower back, and I'll just pass it around here. Let me point out some things first. So this is how it sits in you, or in myself. So we have these vertebrae. The discs are in between the vertebrae. The important thing to note about this, and this is the source of a lot of the problems we see, as you see these little yellow things, these are the nerves that come out of your spine, run down your leg. The important thing to notice is how close they are to these discs. So if you have a disc problem, you often have a nerve problem. One more thing, there's all these joints in the back of your spine. These are called your facet joints. If you've had back problems, if you've seen a spine doctor before, they've probably talked to you about your facet joints. So for your spine to move, to bend and flex, it moves through these discs in the front and these small joints called your facets in the back. And if these go bad, and if they become big and arthritic, often that can compress nerves too. So I'll just pass this around so you can kind of see those relationships. And most of the problems that we see in golfers are twofold. One is disc problems. So those are things like herniated discs and annular tears, and the other are muscular problems. So you can't see on that model, but on your back there's a large group of muscles that allow you to extend like this, and use those extensively, and they're one of the major muscles that you use during twisting, during a golf swing, and it's pretty easy to injure those muscles, and we see that a lot. So that's probably 80 to 90% of the golf injuries that we see. So it's called a paraspinal muscular injury or strain. And the good thing is those get better in most everybody, but it takes time. You had asked, what do you do with an acute back pain? What type of treatment should you pursue? So typically, you go out and play a round of golf, and then your back hurts a lot immediately after or the next day. So typically it's ice. Ice is helpful the first 24, 48 hours. If you can take anti-inflammatories, that's often helpful, at least acutely. If it's back pain as well as leg pain, which we see again, remember in that model that I'm passing around, you can see how those discs are right next to those nerves. So they often come in pairs. If you have a disc problem, you'll probably have back pain, but you'll probably have leg pain as well.
Well, this is in the front.
Yes, so...
And it's on the opposite side.
So let me show you another thing. Let me borrow this back.
Give a diagnosis here.
Well, it's an interesting question, and your spine's put together in kind of a neat way. Mm-hmm. So based on which nerve is being pinched in your back, we can tell you where the problem is. So if you have back pain, you have a problem in your back, but I have trouble localizing it. I have trouble saying it's this disc, it's your L3-4 disc. I know because that's where your back hurts. We're not good at that at all. But if you have leg pain, we can say, oh, pain on the front of the thigh is the L4 nerve, and that correlates to this disc and helps us to localize problems. And it's really consistent across across people. So that they go together in certain patterns, and your pattern of leg pain helps us determine where your problem is. I'll keep passing this around.
What if it radiates to your hip there?
Yeah, so it can radiate anywhere in your lower extremities. And so our job is to know which areas of your leg correlate with which discs. So you can have radiation from your hip. It's a little bit more unusual, but it's not that unusual. Happens from a higher disc problem. So again, the main problems I'll talk about today, you had a question, we'll get to it in just one second. So muscle injuries and disc injuries, those are the main acute problems we see in golfers. There's a lot of other issues. There's degenerative disc disease, there's spinal stenosis, and I will get into that as much as you want. Those are more chronic problems, though. You had a question.
Or the sciatic nerve. Now, how does that relate, or can you point that out on?
Yeah, so you hear a lot about sciatica. Everybody talks about sciatica. It's not a very good named term. So sciatica refers to your sciatic nerve. It's the big nerve that comes down your back and supplies most of your leg function. But what we mean by sciatica is just a type of pain. It's a pain that results from a pinched nerve. So people have radiating pain. It's usually down the back of the thigh, but it can be anywhere. It can be down the front. It can be into the groin. Those things are all sciatica. What differentiates sciatica from something else is it results from a pinched nerve. And again, where that pain is helps us to localize where the problem is. So that's all sciatica is. It refers to the sciatic nerve, but really half the cases we see have nothing to do with the sciatic nerve. If I were to point it out, well, I couldn't because it doesn't exist in this part of your body, but all these little yellow nerve roots come out of your spine, and eventually they coalesce and form these larger nerves, and one of those nerves is your sciatic nerve. So, any other questions as we go along? Yeah, please interrupt. So again, things that we see most commonly acutely, they're muscle injuries. These are paraspinal muscle strains, and those are the muscles that support your back, common in golfers. We treat those acutely with anti-inflammatories. If you come to see a doctor, we'll often give you a steroid medication that you'll take for a couple days to calm down an acute flare. Ice is helpful, and physical therapy and core strengthening is really quite helpful for these. The good news is that almost all of these get better. So most golf injuries get better by 6 weeks, even if you were to do nothing, but we can often accelerate that. So that's one group of problems that we see. The other group of disc problems. So again, I won't make you look at this small screen here. Think of the discs that are in between your vertebrae. Think of them as like a jelly donut. So sorry. So the inner portion is called your nucleus. It's this jelly material. It's literally like a jelly donut. It's soft. It functions to absorb shock. And then the outer portion is this really thick material called your annulus. So you can tear that material and herniated disc, and that's something that we see a lot in golfers. And the problem with that is those disc herniations often push on nerves. So again, disc, nerve right next to each other. So people will complain of acute onset of back pain, of that sciatic pain that radiates down your leg. And again, those are often get better by 6 weeks, but they're a little bit harder to treat. Disc injuries are a little bit bigger than muscle injuries. The difference is that people tend to have leg pain as well as back pain. A muscle injury just causes back pain. So just in terms of back pain, very common. This is the leading cause of disability in the U.S. Most people will have this at some point during their lives for a prolonged period, and during any year, 5% of people are off work for back pain. So it's a pretty big problem, and there's a lot of reasons for that. So I'll go over some of the common conditions that I treat, and then we can talk about answer any additional questions that you have. So one of the common conditions I treat is called degenerative disc disease. It's basically a form of arthritis in your back where you lose the cushion These discs act as a really nice cushion, just like the cartilage in your knee acts as a cushion when you twist, when you walk. So in degenerative disc disease, you lose that cushion. It's something that causes back pain. Sometimes that pain radiates into the buttocks. It's something that happens gradually. So this isn't something that you wake up with pain one day or after playing around. This is something that happens gradually. What this MRI shows, and it may not project that well, but what we'll see is that the disc that's degenerative looks different than the others. It appears black on an MRI, and what it means is that jelly part of your disc, you lose that. It turns into something that's degenerative and not as shock absorbing. So this is a big part of my practice, and I see that as much as anything. I talked about these facet joints, so that's where your spine moves, the small joints in your back. And what this picture shows is what happens when a facet joint goes bad. So we see this in a lot of conditions. We see this in arthritis, and you use these, every time you twist, you're using these joints. In fact, the only way that for your lower back to twist is for these joints to move. And as you age, these joints can become arthritic, just like your knees can become arthritic or any other joint. The problem that we'll see is normally you have lots of room for your nerves to come out of your spine. If the facets go bad and they turn arthritic, you get all these extra spurs here, and that area where those nerves used to be able to travel freely is no longer there. So when your facet joints go bad, not only do we see a loss of motion, a loss of twisting and bending motion, but we'll also often see pain down the legs because those nerves are being pinched. So we talked about sciatica. This just shows, again, based on where somebody has leg pain, we can refer to where they're having a problem in their back. So pain on the back of the calf is pretty reliably from the bottom disc. And there's a lot of similar patterns. I talked a little bit about disc herniations. Disc herniations we'll see in golfers. And I've shown this visually here. So you can see this yellow, this is an MRI. And what we're seeing is that this disc material here is herniated out the back into the spinal canal. It's pushing on nerves. And people who develop this have an acute onset of back pain, pain down their legs. Sometimes they'll have numbness down their legs. And again, this is not something that happens gradually. This happens suddenly. Either you wake up with this or you finish a round of golf and you have this sudden back and leg pain. So this is not an acute injury. Spinal stenosis is something that we see a lot in golfers, and the main, not because you're any different than anybody else, but it's a problem as we age. So stenosis is basically arthritis in your back, and what happens is the arthritis causes compression of the nerves in your back, and people usually complain of cramping. It's worse with ambulation. Sometimes they feel better when they lean forward, and you often see people leaning forward on a cart while they shop because that relieves their leg pain. So that's stenosis. Again, it's not a golfing injury. It's something that we see a lot as we age. It's a big part of my practice, but it's another condition that we see a fair amount of. I'm going to talk briefly about some of the conservative treatments that we use to treat each of these problems, and fortunately they're pretty similar. Whether you have a disc herniation or whether you have spinal stenosis, whether you have a muscular strain after a round of golf, the treatments are pretty similar. So we couple them into a couple of groups. The first are medications, so that's anti-inflammatories, which you'll take for a couple weeks often. Not everybody can tolerate those, but that's often a good option. Other medications are steroid medications, which sometimes people would take just for a few days to try to calm down a flare. The other group is rehabilitation, and we're going to talk about physical therapy and core strengthening exercises as we go, and some of the exercises that are the best in that group. And then the last group are these interventional techniques. So these are things, if you go to see a pain doctor and they talk to you about epidurals or steroid shots, that's what this involves. It involves identifying what's causing your symptoms and then trying to inject a steroid medication to calm those symptoms down. I have a lot in this talk about surgery, and I can talk as much or as little as you want to about that. That's most of what I do for a living. But let's take a break and go through questions that people have.
By steroid, do you mean cortisone?
Yeah, so cortisone is a type of steroid, and we can give it both orally, so little packs of steroid pills that we'll use all the time, or we can give it in an injectable form, and that's a more targeted therapy. Yeah, please.
So, I assume that most of us in this room don't want surgery, and we want to keep playing golf, and we have, I'm again assuming that most of us have we've had back pain for some time, off and on, and it interferes with our playing golf. So let's just say we have, I'll speak for myself, I have degenerative disc disease, even a little scoliosis, which is just curvature. My spine isn't good and straight. It has sort of a curve in it, which I didn't deserve, but it's there. And if I play golf too many days in a row, the pain builds up. What do you recommend for me?
Yeah, so again, that's common, and there's not a definitive fix for that, right? Because when you develop arthritis in your back and when you develop degenerative disc disease, your back is your symptoms are related to how much you do often, and so if you go out and play 36 holes, yeah, it's probably going to bother you, and there's probably no way to completely stop that. So things that we can do to treat this, often we'll use a long-acting anti-inflammatory, and in the early stages that can be enough to let people do whatever they want, and that's great. And most people who have had symptoms for a long period of time, that by itself isn't going to cut it, and I'm sure that you all know that by now. So the other thing that we can do to maximize our abilities in that area is core strengthening. So physical therapy, keeping a strong core. It allows you to take some of the load off your back during activities like twisting, like just daily activities, walking and bending, and so that's pretty helpful. It's not a complete solution, and if you have bad enough problems, you're going to have symptoms no matter what we do, especially if you're doing things like playing golf, which is fine. I'd never tell anyone not to play golf, ever. But you know, it's often we do the best that we can to calm down your symptoms. There's not always a way to completely eliminate them. So, other questions?
Do you recommend, as a normal course, stretching kinds of exercises?
Yeah, definitely.
And I know that strengthening your stomach muscles is the best thing you can do for lower back. And what do you do there? Crunches and things like that?
Yeah, so core strengthening involves strengthening your core, is your abdominal muscles. There's also the muscles that support your spine. When you're sore because these big muscles that allow you to extend your back are sore. And so both of those make up your core. Do you want to jump in and
sure.
talk about some of these core strengthening?
Yeah, I can go ahead and talk about some of that.
Yeah. We have a handout, I think, on common exercises too.
Yeah, I really like what Dr. Mina was saying about how whenever you twist, every single time you use those little facet joints. The facets are kind of like my clapping hands. If you turn one direction, it'll hit here. Other direction will hit here, and that's the story of the low back. And there's honestly not quite that much room if you would want to take another look at it. And this actually does a fairly good job at twisting. That you can see how there's really not that much twist to a low back, and that's where, like Dr. Mina was saying, that sometimes if you twist too much, that can start to rub and tear at your discs and cause potential disc herniation. And so this is where I like to say, as a physical therapist, I like to cheat. You know, if the back doesn't do a very good job of twisting, well, where does it get a good job of twisting from in the first place? And that's where I have to look below the joints and above the joints. I say, what's south of this low back? You got your hips, and that's a ball and socket joint. What better to do twisting than a ball and socket joint? And we all know that hips are a very, very important place to start with a golf swing. As golfers tend to get a little bit older, and this is what I realize in my practice, that they'll start to do what with their feet? Have you noticed this with any of you, maybe some of your friends? Whenever someone golfs, typically you want your feet to be straight forward like 11s. What happens in some golfers, as you see with some of your friends? Anyone? I've seen it start to toe out.
Whoa.
You got that. Because what they're doing, they're allowing a little bit more freedom of motion through their hips. But primarily I find that's because they've lost some flexibility in their hips to keep it straight forward. And so that's where I say, okay, back's not designed to twist, but hips are, but now you're starting to toe out a little bit, which I don't know if that's good from a biomechanical perspective, good from a strength perspective, because I think that if you're all to go out and swing completely duck-footed, you wouldn't get very far. You lose power in your butt whenever you swing like that. And so that's where I say, okay, well, if you're starting to toe out, that to me is a little yellow flag sign saying, ooh, something's changing in your body, something in your hips changing. How can we get that a little bit better? And so that's where I have two different stretches, and actually this would probably be a good time just to pass these out. And the stretches, I'll steal one just to make sure I'm on track too. These two stretches are going to help this outside part of this hip become a little bit less flexible. And so the gentleman over here said that he was hitting golf and you felt the pain in the front. Was that your lead leg in golf?
Yeah.
Are you a right-handed golfer?
I'm a right-handed golfer.
Yeah.
It's the left side.
Perfect. And that's oftentimes what I see in a lot of people. So all these exercises are really focused on a right-handed golfer. If you're a left-handed golfer, just flip them in the mirror image and you got the idea. Because typically what you want in that front, in your lead leg in golf, is your hips have to go over your foot. Your belt buckle has to turn towards that pin, right? And so that's what these exercises, these stretches, these first two on the top are supposed to gear for. So the very first one I like to start with is this IT band stretch, where I have a person first turn their toe in. I like my golfers to keep the ability to keep their feet at least straight, if not be able to turn it in. Because when you go through your golf swing, if I were to look down right now, where's my foot? It's inward, right? You don't start it with it inwards, but as you go through your swing, it ends in an inward facing position. So that's where this first stretch stretches out your IT band, all the muscles that attach to it. So I turn that foot in, cross over with the right, butt my hip to the left. That's where you'll feel it right here. And you get a little bit more if you come this way, even more if you twist away with it. Which that's kind of funny. Whenever you take a look at me doing this, you might say, that kind of looks a little bit like my golf swing. So this really helps. I'm a big proponent of practicing like you're playing. So someone said, is a good core exercise good for crunches? Well, I don't see too many golfers, swing like this. Maybe if you're playing croquet and you're hitting behind you or something, maybe that would help. But I'd say, how can we get your hips to move the way that you want them to move in golf? Let's design some exercises that kind of look like that. And so this IT band stretch is one of the first ones I like to give. The second one I like to give is also this hip flexor stretch. And this is where you might notice I didn't do that very well. I don't have the best golfing because I don't have too much hip extension in my left hip. But as you come forward, you don't want to just stay in this kind of crouched position. You need to get up and away here. And so that's why, with this hip flexor stretch, I encourage the same thing. The first step, turn that toe in, take a step forward with your right foot, and then lean forward so you feel this nice stretch right here. Again, this is looking maybe a little bit more like a golf swing. If I were to take a snapshot of you right here, you'd say, ooh, not only does that your hips have to go over your toe, but your hips can't stay in a crouch position. They have to come up a little bit. And that's when I see a lot of my...
That's good.
This is where I see a lot of my master's age golfers. They start to hunch over more. They start to toe out more, where they're taking out this big strong butt where you get your power, the nice hip joint, which should help you twist. And so instead they're crouching over, they're spinning over, and what has to do more of the work? The low back. And that's where you can get the annular tears. That's where you can get the paraspinal muscle strains. That's where the low back muscles just can't handle that much load. So that's why I like to say cheat. If someone comes in with very acute back pain, I can still give them hip stretches. Typically, they don't argue with me on that fact, especially whenever they're in a lot of pain. I say, okay, well, I'll make you a deal today. You're in here with tons of back pain. Let's do some things with your hip that'll help your golf game. People say, okay, I'm game for that. And so not only does the hip help with that, help with your golf swing, but then if I look at the joints above the back, your thoracic spine, those joints are a little bit different. Remember when I was saying that the low back facets are oriented kind of like my clapping hands at one side and then to the other? The thoracic spine ones are oriented more on a vertical axis, that they more stack on top of one another like this, which that allows for a little bit more twist. And Dr. Mina was right. Very few people come in and say, ooh, I have pain in the center of my back. Very few people say that. And I don't know exactly the reason why. Maybe Dr. Mina will have a little bit more expertise on that. But I've noticed with a lot of my golfers that have a low back pain, that are developing some tension of their hips, they can't twist through this upper part of their body very much. And that's where these exercises are helping with that as well. So again, if you're a right-handed golfer, so with the lower body ones, that was all going for your follow-through. A lot of times with my golfers, if they have more pain come in their backswing, I find that it can be due to up here. So that's where these exercises are geared for more dealing with the top joints, the top muscles as well. So the very first one, so if you're a golfer, you say, okay, my feet are straight, my knees are bent. I know my right hand and my left hand have to go in this direction together to help get that club face back. So I look at my shoulders and say, okay, I know this shoulder has to twist. I know that there's a lot of senior golfers that I see that they stop to lose this amount of twist, that they start just to bend at their elbow more, that they play with their elbows tight to their side like a Tyrannosaurus Rex playing golf, that they'll start swinging like that. Why is that? Well, just like how I see people lose their ability to keep their feet straight because of their lack of hip mobility, people start to play with their elbows whenever they've lost a little bit of the ability to twist at this part of their chest to open up. And so that's where I say, okay, well, how do we open that up? First stretch would be this pec stretch, where if you're in this position, you can twist back here and you can feel the stretch all the way right here. You could say, oh, that's going to be a fairly decent stretch for this part of my chest. I might not go to this with someone with acute back pain because this also twists a little bit at the low back, but there's many ways we can compensate for that, and if you're my patient, we'll talk through that. And then, so not only does my right hand have to go back, but then my left hand has to go back as well. And so this is where I developed this other stretch where you're holding here and you're twisting right here. So you can see how much my shoulder is starting to spin on top of my pelvis. And so that's how I kind of break things down for my patients. I say, okay, when are you having the pain? Is it in your backswing? Is it in your follow-through? What happens to your hips? When does your back hurt? When does something else hurt? And we can reach those decisions together. So after you do all these series of stretches, I'm a big fan, because that's the number one thing I see in my senior golfers, that they start to lose flexibility. So that's one of my first go-to things. We're going to at least get you flexible. Will it help with your back pain? I don't know, but if we get your hips more flexible, maybe you can get a few more degrees on that club. Maybe you can increase your drive 10 yards, just because we're gaining that much more flexibility through that. And so after I like to do stretches with people, I like to pair that with some exercises. And so if you go again on the top part for the hip, all the way to the right, this is probably my golfer's favorite exercise, because it integrates balance, it integrates range of motion, and it integrates strength in that left hip, which we all said that we agree that you need to be able to spin over that. It's a rotational lunge where you glue the left foot to the ground and your right foot comes twisting all the way over right here. There's a lot of times I lead someone through that's been playing golf their whole life, take them through this one motion, and what do they almost do? They almost fall, that they've somehow lost that balance, that somehow they've lost that mobility. That's why I like giving this exercise. If you can't do it the whole way, we'll start a little bit initial range. Don't go quite as far. But with the goal of that, you want to get that belt buckle all the way over towards the pin. Kind of makes sense? Mm-hmm. So for a lot of my golfers, they love that one. They're so limited. I kind of measure how far they can go, and they say, oh, that's where it's tight, that's where I feel this. Some people, I get them right here, and they say, oh, man, that's my back pain right there. And I take a look at your foot and say, your foot didn't go too far. I wonder if we can cheat. Give the hip a little bit more motion, and if your back continues to get worse, then maybe talk to a guy like this and figure out what he can do for you. And so, again, now going down to the bottom, after you do your stretches for the upper part, I like to pair them with exercises as well. So in your golf approach stance, I like to have people learn how to twist their body one hand at a time. So they can reach over here, come back, and then you can work it. For some of my, for some people that are going through therapy very well, I might put a dumbbell on their hands, a free weight, and have them come all the way back, and this will start to develop some of the shoulder strength. This will actually start to develop some of the core strength that's needed to swing. And then the very last thing, then not only does the right hand go back, but the left hand needs to go across as well. So then I have people scoop up and away. And this is where I can apply therabands, weights, anything that you can imagine to get people this kind of mobility. And so this is where I like that these first stretches and exercise that I gave you kind of work on one thing at a time. In therapy, after my golfers are getting pretty good, they're getting flexible again, and they might just be still having a little bit of nagging pain or still might not have the balance to complete their swing. This is where I'll combine the exercises. I say, well, we know you have to twist towards the left for a right-handed golfer, but your hips have to kind of do the same thing on this side for your backswing. So that's where sometimes I marry these and do them on both sides. And then this looks like a little do-si-do, but this is working at that hip mobility. This is working at that hip strength to be able to control it and helps with your balance so you have a good balanced golf swing. Any questions on those? I threw a lot at you. I know.
That's good.
So if you're at all hesitant with any of these and you're saying, ooh, Andrew, I don't know about this one, I'd say, well, because I don't know if I have the good enough balance. I'd say, well, first thing, hold on to a wall, hold on to your countertop. Make sure you're in a safe environment. I don't want to see any of you guys, nor does Dr. Mina, after you fall because of trying one of these. So hold on to something, be fairly smart. The first two in each section, those are the ones that you hold for a period of time. You should feel a nice, good stretch with that. If you're having other pains, that would be a good call to Dr. Mina or to me to figure out what we can do about that. And then for the other exercises, I don't think you'll have there very much of a balance challenge. But I'm hoping that you all kind of say, this kind of looks like golf. This kind of smells like golf a little bit. And I'd say I hope so, because I want you to practice like you play.
You mentioned using a band.
Mm-hmm. Yeah, and there's a lot of different exercises I can give people with bands. And to me, it just depends on what someone's really motivated to do. I think that a band offers a different kind of resistance than a free weight, and there's sometimes that I'll start with someone with a band and work up to a free weight. At the very end of my golfers' treatments, I like them to be able to take at least a 2-3 pound weight and be able to swing it however far they want to, because what is that free weight? In your world, your free weight is your golf club. Might not weigh that much, but I want to make sure people can at least take a free weight from here to here before I say, okay, happy trails, have fun, play your front nine, and tell me how you feel.
Could you show that rotational lunge again?
Yeah, and so this one's a little bit odd, and I'll come over here so you can see it as well. For a right-handed golfer, that they need to spin their whole entire body to the left. I say glue that left foot to the ground so it's not moving anywhere, and with this right foot, try to get it to spin all the way towards the door. So if you're to look at where my belt buckle goes, it's facing you, and then it's going all the way away from you. Just like if you were the ball here, I'd hope my belt buckle will go from the ball all the way to the pin, so they can get that. Make sense? And then it's the exact same to the other side. You can glue your right foot to the ground and move your left foot over too. And you'll recognize inflexibilities. If you're keeping a key eye on me, you'll say, Andrew, that does not look symmetrical. And I'd agree with you. I have a lot of things going on and flexibilities in my hip, but I'm working at it. Whenever I first did one of these opposite rotational ones, it was pitiful. You would have laughed at me. I almost fell over. But after working at it, after saying, why the heck can't my hip do this? You start working at it. And that's the beautiful thing about our body. It has the ability to change, it has the ability to adapt.
When you say bend through your left knee, I thought you were straightening the left knee before.
Oh. So in this exercise, did I say bend through the left knee? Oh, that was actually a little bit of a typo. I should have written bend through the right knee if you wanted to go a little bit further. So if you want to change that on your sheet, I do apologize. Because typically at the end of your golf swing, you do want to keep that left knee somewhat extended. So you're right. Thank you. That was a typo.
What kind of success have you seen with people come in with low back pain and they've got some degenerative arthritis, and so you put them on core exercises? how many people are dramatically helped and how many people are, just in general? I realize there's all sorts of levels of arthritis and.
Yeah, right. And I kind of agree with Dr. Mina. A lot of people that come in here having pain with their golf, you know, I'm hoping to get them better within about 6 weeks. I mean, I'm not saying that I'm 100% accuracy, and that's where Dr. Mina's practice and I, we complement each other, because if we go for 6 weeks and things are getting worse and worse and we're not getting any traction, even though we're trying everything, trying to cheat from up here, trying to cheat from down here, doing everything across here, and if you can't get, then that's where, you know, having someone that can maybe help with that pain, medication, you know, worst case scenario surgery, that's the way to go. So I don't want to guarantee you anything, but for me, we treat a lot of people that play golf. And Fountain Hills is a big golfing community, just like Rio Verde is. And I'd say probably 30% of my patients, that's one of their top 3 goals. I want to get back on the course again. What can you do for me? And so
what place in your treatment does core exercises play? How important is that?
Oh.
Is that more important than this or less important?
Yes. It's all important. And that's where these exercises I'm showing you, you might say, that doesn't look like a core exercise I've ever really seen before. And I'd agree with you. It's not a traditional crunch that we all did in PE growing up. It's not, you know, and that's where, as physical therapists, I think a lot of my colleagues and I, we're going away from some of the traditional ways in which we were taught that the only way to get your tummy tight and get your core strong is to do sit-ups. That actually puts a lot of stress on a low back, and that's, like I said, to me that doesn't look like you're practicing like you're playing too much. I don't know too many people that have to do this repetitively. So the way a person's core has to work, at least in golf, is they have to be able to slow this motion down, so all your abs and your oblique muscles, which are big muscles in front of your tummy, they have to be able to stretch out and hold to make sure you don't twist too much, and then you could end up with back pain. And primarily having a lot of core strength whenever you go through your follow through, because that's where you're really accelerating, and where right when you hit that ball, that's where your body has to put on the brakes and say, slow me down, and that's where these core muscles will have to work on slowing you all the way down so that you don't just hit your facet joints hard time after time. Will your facet joints still hit whenever you, yeah, but are they going to slam together, or are they going to hopefully do it a little bit more slowly? Any other questions with that? Well, thank you for
Thank you. So that touched on a couple of points that we wanted to talk about tonight: core strengthening exercises that you can do, and non-traditional ways of strengthening your core, which is most of what's on your handout, which seems to work a little bit better for people who do have back pain. I want to see what other types of questions that you guys had about back pathology and about things that we do to treat them.
Mine's kind of weird.
No, weird is fine.
3 weeks ago, I just can't sleep on my side. That's the only thing. It hurts to sleep on either side. I have no pain really when I'm up moving, or when I'm laying on my back, or
In your hip or on your
it's right in the middle of back.
Yeah. So for some reason, I'm not going to have a very good answer for you.
I figured as much.
But we also see that frequently, where you do enough to either strain a disc to strain a muscle that certain positions are uncomfortable, and when you sleep on your side, you're creating a curve in your spine. It's temporary and it's controlled by position and muscles, but certain positions cause pain, and depending on where your disc problem is or where your muscle problem is, it may be that you only stress it when you put a sideward bend in your spine. So very, very common what you feel. If that's all that bothers you, then hang out and it'll go away. you know. But we'll see that often where people can't lie flat on their back, but when they're up and around, everything's fine. So
Okay.
those positions are often a bit of trial and error too, figuring out what positions are most comfortable for you after an acute injury. Yes.
So there's been a lot of publicity about these anti-inflammatory medicines, and they come out and they're godsends, and then they find out they cause cardiovascular problems and they get taken off the market. What is your choice of an anti-inflammatory non-prescription. So if one of us, you mentioned earlier, that'd be one thing we would want to try if we had acute back
Yeah.
pain. What is your choice?
So
The safest and most reliable and anti-inflammatory that you can get without a prescription.
So most anti-inflammatories are pretty similar, and the prescription strength ones have a different half-life. They stay in your system for a little bit longer, but they work the same, and they're all pretty similar. And maybe I can prescribe you one that's a little bit stronger than what you take over the counter. But we often prescribe what people take over the counter. So you asked a question about safety. These medications, outside of people who have kidney dysfunction or ulcers in their stomach, are pretty safe. It's not something you want to necessarily take for years at a time because there are certain cardiovascular risks.
So which one do you recommend?
If you have an injury, very safe to take for a couple of weeks, and I wouldn't think twice about it. We use naproxen a lot, or Mobic's going to be available over the counter soon, but naproxen or Aleve is what I usually use, only because it's a little bit easier for people because you only have to take it twice a day. So 500 milligram tablets is 2 of the over-counter tablets. It works about as well as anything that I can prescribe for most common injuries. Other questions? Yes.
Speaking of sleeping, how about mattresses?
Yeah, that's another it's another hard question to answer. So
See you guys.
all right, thank you. So
Thank you.
Thank you. So typically people with back problems prefer firm mattresses because it limits how much your back curves when you sleep. And eliminates stress that you have in your back during certain positions because you don't move as much on a firm mattress. When you lie on your side, your spine doesn't curve as much. So that's the traditional teaching. But it's also a bit of trial and error. Sometimes people feel miserable on a firm mattress, and that's what we usually tell people, but everyone's a little bit different. So if you're shopping, try out a bunch. What other questions? Yes.
Most of us in here probably have AFib or something that requires your blood to stay relatively thin. And aspirin is what they generally prescribe. But now, if you're mixing Aleve and aspirin together, is that a good combination? When you're working on 2 different things at the same time.
Yeah. So aspirin's not a great anti-inflammatory. It's a good blood thinner, and we use it primarily for its blood thinning properties. So we use it to prevent blood clots on occasion, especially for heart disease. But it's not a great medication for pain. It's just not as strong of an anti-inflammatory. Typically, you can take aspirin and another anti-inflammatory, and that's just fine. It's just not something you want to do for months and months on end, and the reason being is they can both irritate your stomach, and if you start stacking them, you have more irritation of your stomach, you can get ulcers and so forth. So again, most of these things for a week or 2 at a time during an acute injury, really, really safe, and you don't have to worry about kidneys failing, about heart attacks, about all these things you read about in the media. But if you take them for years at a time, you can run into some of those problems. So what other questions do we have? Anything else?
Well, I guess one of my questions was the core exercises. I'm still a little confused because I've been doing those, but I've been doing the crunches and lying on the floor and lifting my shoulders up to the back extensors, some sit-ups to the sides. And I assume those are still okay, but you've had better luck with this approach than the traditional thing that I just described.
Correct, yeah, and there's at times that I do integrate some of the other exercises you might be more familiar with. But like I said, I'm not the type of person to say, how do you like to play, and then kind of dial back at that and say, okay, well, let's take it one step away from golf. And there are times that for some people that are really acutely sore, I will start on the table and I will have them do some gentle core exercise to where they're just at least able to activate their core without pain. That might be the first step in a long journey to get you standing and swinging a golf club. Sometimes I don't like to start all the way at the basics if you can already do the basics well, and that's where I try to dial back, maybe take one step back and see if we can go there. If not, take 2 steps back rather than say, oh, I don't trust your body at all. Let's start from ground zero. Now, there's times that someone comes in fresh off of surgery where we have to start at ground zero. And then I start all the way from the beginning. But on my community dwelling patients that are avid golfers and they're just coming in to me just because of ache or pain, I say, okay, well, let's dial things back rather than start you with the easy things. It's just like if someone came in just with problems with walking, I wouldn't say, okay, let's start with crawling, because that's what kids do at the beginning. Could that help some of the muscles? Absolutely. But there might be a different approach to go at this. And this is a little bit different than maybe the things that you'll read on the internet, different things that you might see on YouTube. But at Spooner, we pride ourselves in having really good outcomes with our patients. We pride ourselves in staying as progressive as we can to get people back to what they love doing fast, and faster than other PT places around.
Good job.
And so, any other questions for Dr. Mina or for myself? He's the new guy in town. All my patients are loving this guy. They come in and then I see that Dr. Mina has written a prescription for them and ask about their time. He's a good guy, so get an appointment with him while you still can.
Well, if there's nothing else, feel free to come up afterwards. Otherwise, I suppose we're done for the day.
Thank you.
Thank you.
Thank you
Thank you.
very much.